Question number 5. A 72-year-old man gets a dual-chamber Boston Scientific pacemaker, and after the device is noted to have frequent episodes of right ventricular pacing, and right ventricular pacing events are captured on this 12-lead electrocardiogram. The device is programmed with a low rate of 50 with a AV delay at low rate of 220 milliseconds. AV search hysteresis programmed on with a search AV delay of 400 milliseconds. The question is, what finding results in change to the RV pace morphology as shown in this electrocardiogram? Going to the answer, what can be appreciated in the left hand of this electrocardiogram is that there is atrial pacing artifacts, and they are followed by subtle but pointed out by these arrows, this ventricular pacing artifacts, as intrinsic AV conduction is manifested by a very narrow, normally conducted QRS complex. The pacing output is delivered just at the beginning of the QRS before the device had a chance to be able to sense the intrinsic conducted beat. However, late enough where it does not alter the normal narrow QRS complex morphology. So this is an example of pseudo-fusion, correct answer being pseudo-fusion. And because from the device perspective, the device outputted the pacing and there was no intrinsic conducted R wave that the device ever saw, the device switches to the programmed AV mode in response to AV search hysteresis with a programmed AV delay of 220 milliseconds, resulting in ventricular pace morphology shown in the right half of this ECG. So what is fusion and pseudo-fusion? This is illustrated in this 2-lead ECG recording in the bottom right. What is shown on the far left is an intrinsic narrow QRS complex. On the far right, conversely, is an is a ventricular pacing artifact followed by a wide paced QRS morphology. Fusion, then, as shown in the second and the fourth beat, is a beat where there are characteristics from both. It's a fusion of the intrinsic and the paced when both occur at the same time. Pseudo-fusion, then, is when there is a pacing artifact on top of the QRS complex, but as was seen in this example, is late enough for the artifact to not be able to perturb the QRS morphology. So there is a pacing artifact, but the QRS morphology looks like intrinsic. So there is no fusion, hence pseudo-fusion. Pseudo-fusion, on the other hand, occurs when it appears like pseudo-fusion, but the spacing artifact is coming from pacing spike in the other chamber. For this example, would be an atrial pacing artifact falling on top of the QRS complex. So appears like pseudo-fusion, but is from an artifact in the other channel. The dictionary definition of hysteresis is provided, but for our purposes, there can be either the rate or the AV hysteresis. The example for rate hysteresis would be a device programmed at a rate of 60 beats a minute, but allows intrinsic conduction to manifest till dropping below 50 beats a minute when pacing is instituted. On the other hand, AV hysteresis, as was exemplified in this example, allows intrinsic AV conduction, for example, to come up to 400 milliseconds before it switches to AV pacing at the programmed AV delay of 220 milliseconds. So positive hysteresis in this example is to promote intrinsic conduction, but you could also have the opposite or negative hysteresis to promote pacing, for example, atrial preference pacing or CRT algorithms that will shorten the AV delay with the occurrence of intrinsic conduction. A quick word about hysteresis, AV hysteresis, again, as demonstrated in this figure. So because ventricular pacing is outputted for device purposes, there is no intrinsic conduction for 3 out of 8 beats for this Boston Scientific device. It switches to a shorter programmed AV delay, maintaining AV synchrony.